So right now, though, we want to focus on civil society matters because there is so much to discuss. Health and biodiversity, a focus on value added. We will discuss that this morning. And our guests, to tell you more about it, we have Mr. David Bynoe. He is the National Coordinator with the GEF Small Grants Program, UNDP. And we also have Dr. Hensley Sobers, Executive Secretary, Codrington Trust.
That's right.
Good morning to you.
Morning to you.
And we have Dr. Michael Clarke, Principal of Codrington College, joining us as well. Good morning to you.
Good morning.
All right. So we start with you, Mr. Bynoe, to, of course, set the tone. We've been discussing a number of things as we focus on civil society matters.
That's right.
So we give you the opportunity to lead us into today's focus.
Yeah. Today's topic is really, before I start, let me say formally, Morning Barbados. And this is really a wake-up call for Barbados. It's saying morning to Barbados in the sense of get up, because we are really grappling with life. Life is something that is very fragile. We just saw there in the news whereby one of the flights from Ethiopia would have crashed. Well, look, I'm scheduled to be in Ethiopia in 2 weeks.
Wow.
I could have been on that plane.
Well, just not a Boeing 737. At
Yeah,
least those
yeah.
have been grounded for now as they carry out the investigations.
And that's it. And many of our colleagues were on that same plane. And we do have senior UN officials, Barbadians, who are based in Nairobi, and they would fly from Ethiopia to Kenya. So we don't even know if a Barbadian has been touched. So when we speak about life, when we speak about health and wellness, you know, we need to ask ourselves, what are we doing with our life? How are we managing it? You know? And this initiative that we're speaking about this morning looks at that. It looks at health and wellness and see how we can actually take control of our destiny. When we put this in context, on the global level, Sustainable Development Goal number 3 speaks about promoting health and well-being of people. And that's extremely important. And that's only second to no hunger, to no poverty and zero hunger.
Right.
It's only behind those. So number 3. So it's after zero hunger, and it's also after no poverty. And it shows you the significance, because we have 17 Sustainable Development Goals. So if that's number 3, that has to be very, very important. And if you look at the national level, we spend about $750 million every year on healthcare, and about 11% of that is spent on pharmaceuticals or drugs. That's about $82 million. And it shows you the significance of this health sector. Now, we can change this challenge into an opportunity. We can transform it. Government spends about $330 million every year of that $750 million. And guess what? There's another $420 million that we have to pull our pockets directly and spend on. So if we can have initiatives like what the Codrington College is doing, funded by the Global Environment Facility Small Grants Program, we can turn this challenge of spending so much on healthcare into foreign exchange saving and even exporting, things that can help raise the health of other countries as well.
Well, maybe Dr. Sobers and Dr. Clarke can talk a bit more about this initiative at Codrington College. Explain to us what you're doing there to promote health and wellness on a big scale.
Yeah, we were very pleased to join the University of the West Indies and the sponsored program, the UNDP, to be part of this program. And as a matter of fact, we have the space and potential to make this program very economically viable as well. So as we look at the social impact, we are also looking at the economic impact. In fact, we say that we are harnessing God's gifts of land, water, wind, and sun in order to make this project a viable project.
Yes. Reverend Dr. Michael Clarke, perhaps you can share a little about how the face of the college, the grounds have been changing in your long-term plan.
Well, basically what we've been looking at is we've recognized that for many years the college has been focused for seminary training, but we're realizing that there are other areas in keeping with the intention of our founder, doing good to men's souls while taking care of their bodies, basically. And so what we've been looking at are ways in which we can expand what we have been doing in the past to include things that are current, things that would join with the wider community in terms of helping persons develop the whole idea of wellness. One of the things that we are noticing is that there's a growing number of Barbadians who are looking to nature for their well-being. You see them on Sunday mornings on hikes and walks, etc. And so when the university came to us with this opportunity to sort of bridge a gap between some of the old wives' tales and modern medicine, we were happy to get into it, because what we've been hearing is that there are a lot of things that we've been using as persons within the context of Barbadian society, but there's no scientific evidence backing it. So the university wanted to look at, so how do we use these various things? How have they been used in the past, and is there really any efficacy to it? So that's where we have joined with the pharmacology department to look at how do we research some of these things that our grandparents have been using.
And you need to know Dr.
yes.
Sonia Peter as well.
Yes.
She's a fount of knowledge
Yeah.
when it comes
And
to these things.
this is the whole role of the Small Grants Program, to coordinate these things at the national level, to ensure that we're not replicating, but we're delivering as one and in a synergistic way. So in terms of this initiative, it's an excellent partnership. You have not only the Codrington College, but the Codrington Trust working collaboratively. You have the University of the West Indies. And because we're very community-based, the community is involved. So you have all the residents around Codrington lands, they're involved. And because we're not delivering silos, Dr. Sonia Peters and other initiatives, we are bringing these partners together and ensuring that they're, civil society, we connect the dots and ensuring that these matters are addressed. Now, this is extremely important because the Prime Minister herself would have prioritized health and wellness by creating a Ministry of Health, but not only health and wellness. And the whole ethos behind that is to incentivize Barbadians to actually look at preventative care and preventive medicine rather than curative. Now, in developed countries, they spend a lot of their budget on curing things and treating things. In a developing country, we should spend our budget on preventing them from happening. And this is why this project is so amazing. I'm going to give you some key components of the project. So it looks at identifying at least 5 plants with medicinal or nutraceutical value. And a nutraceutical is something that you take or you eat that has health and medicinal benefits as well. But it goes further than that. It documents these plants and looks at efficacy and also safety. So when someone says, well, Cassandra, take such and such, or take such and such, sobers, but how much?
That's always
and if I take too much, what is the effect?
Yes.
And so these type of things, but it also catalogs these things, creates nature trails. So when you come to Codrington College, it's not just about the spirit. The spirit is good, you lift your soul, but you get an exercise, you go on a trail that is so beautiful. When you get to the top and you look down, you see the East Coast is like, wow. And you also get the health benefits from what they're packaging, because we spoke about value added. They're doing that as well.
So where are we now in the program? How far along are we?
You want to?
Right, basically at this point in time, the ground was prepared. We've done some research in terms of the community. We got some students from Cave campus to go around our community and have conversations with persons with respect to what are the things that are being used, what have they heard from their grandparents, what have been used for. And all that material, all that data has been collected, and currently it's being put together so that there is an actual document that we made available to the wider public to see these are the things that Barbadians through the years have been using. So that aspect of it is almost completed. With respect, as David was saying, with respect to the actual products, what we're doing now is we're taking those five items and we're preparing them for cultivation. And we're being assisted by the organic growers of Barbados. So it's a community-based, right? So we're pulling persons together so that we make sure that it's not, Codrington College is not entire culture, but we are pulling our neighbors together so that we can have
allowing
the
the space to be used
even
more.
fully. Yes.
Thank you guys so much. Final quick word, David.
Yeah, just the word of His Excellency Ban Ki-moon. Climate change, global warming, poverty reduction, securing our health, and fighting, ensuring that there's no water scarcity. All these are really one problem, and solutions to one must be solutions to all. So let's look at being very innovative. When we solve one problem, let's be solving several at the same time.
Excellent.
Thank you.
Inspiration for us here this morning on Morning Barbados.